Hey, what's up everybody, and welcome back to the Sanctuary. I'm your host, Professor C, and today we're going to do some more A&P. Specifically, we're going to look at the thigh bone called the femur and the kneecap called the patella. So let's check it out. Alright, here we've got two femurs. We're seeing the anterior aspect on this side, and we're seeing the posterior aspect on this side. But some general things about the thigh bone. Again, in anatomy, this isn't technically called the leg. The technical leg, or what we call the anatomical leg, is actually the tibia and the fibula, which you may call the shin bone. So the thigh bone is technically a thigh bone and not a leg bone, even though that's a little confusing to some people. So it is the biggest, thickest, strongest bone in the body. It's hard to break a femur. If someone has broken a femur and you work in an ER and you hear on the radio they're coming in with a femoral fracture, you know it's pretty bad because that's a pretty tough bone to break. You've probably broken some other things as well. So if you watch the humerus video of mine, and you've learned the parts, the structural pieces, parts of the humerus, then you kind of can see them on the femur as well. Although, strangely enough, some of them have much different names, and some of them have, kind of similar names. So we'll get to that in a moment. We will, if we're a femur, the head of it will articulate with the acetabulum of the pelvis, which we talked about in the previous lecture, and the patella, the kneecap, which isn't shown here, and then, of course, the lower leg bone, but only one of them, but only articulates with the tibia. It actually does not touch the fibula in anatomical position, or any other position for that matter. Okay, let's take a look similarly to what we did with the humerus bone. We looked at the proximal end and the distal end because there wasn't really too much exciting going on in the middle of it. So let's do the same thing here. So the head, I think, of course, is pretty easy to spot. In this, it's labeled a 1. I'll just put a head, an H for head here. I think everybody can see that. In the bone on the left, I'll put an H here for head also. And notice, though, that it's got a hole in the head, right? I'm putting an arrow right here, and if you have a really good shot of this, you can see that hole right there. I can see it right here as well. The humerus did not have that hole, but the femur does. So sometimes if you can only see the head of the bone, that's a giveaway. It's going to be called this structure here with an F, the fovea, which means something like a spot. And capitis, we've seen before, meaning head, a head spot, roughly is what it translates to. So there's the fovea, or the fovea capitis of the femur. I can label that over here too, fovea capitis. It's found in the head. The neck, I didn't really show you because it's pretty obvious where the neck is here, where it's labeled 2. There's the neck. And it's the only neck we talk about. Remember, the humerus had 2 necks, but we're not going to go there here with the femur. All right. If you remember, the humerus, it had 2 large lumps. One was called a greater tubercle, and the other was a lesser tubercle. In the femur, it's called greater and lesser trochanters. So right here, I'm outlining the very large, unmistakable lump, the greater trochanter. Trochanter is, I believe, an old Greek word or a Greek root referring to a runner. So we use our femurs to run, and so that's what they named it, a running structure, the greater trochanter. The lesser runner structure is here, the smaller of the 2 trochanters. So there are the 2 trochanters of the leg, the greater, I should say the thigh, right? Even I do it still. The greater and lesser trochanters. Now, in between those structures, right here, where I'm drawing this blue squiggle, there is a named structure. And it matters a lot whether you're looking at the back or the front. Now, because we are looking at the back, and I can only tell here because it says posterior right here on this image. Now, if I could see the bottom of the bone, I could instantly tell I was looking at the back, but it can be a little tricky when you're looking at the proximal end. From the back, it's called the in-between, trochanteric, right? The crest in between the two trochanters, the intertrochanteric crest. If I were to flip that bone over and show you the anterior aspect of this, which I will do in a little bit, you will see a slider structure there. It's not as dramatic. It's much more like a speed bump than a cliff face. It's called the intertrochanteric line. And I put a star here just telling us we can't see that structure if we just see the back like this. We have to see the front because the anterior aspect of this bone is the only place you can see the intertrochanteric line. Okay, looking at the distal portion of the femur, and before we get any further, look over here on the right. Here I see the greater trochanter, here's the lesser trochanter, and I know I'm looking at the front of the bone now just because I'm familiar with it. Here would be the intertrochanteric line, found only on the anterior aspect. So let's label some things that we can see on the distal end of the femur. Okay, so again, what we need to know is this is the back side over here, post, and this is the front of the bone, anterior, and they look different enough where we can see different structures in different ways. So the two things that stick out easily and make it very simple for me to tell that I'm looking at the back of it is to find those two egg-shaped condyles. Remember, a condyle is a part of a bone. It's usually rounded off, and it usually is telling you by the name condyle that it's going to articulate with another bone. So right here is a condyle, and right here is a condyle. Now it's hard to tell which is which in this aspect, and you can kind of see one here, and you can kind of see one here, but one of those is the medial and one of those is the lateral condyle. It's hard to tell exactly which one is which just by looking at this. The intercondylar fossa is the thing in between. And then depending on which one of those is the medial or lateral condyle, we can see the two epicondyles jutting out that way. So there's the two epis. We just label them epi and label these the condyles. And then in between, intercondylar fossa. Now, if you look at the anterior aspect of it, you can see this spot here that I'm hashing out. That's called the patellar surface, and that is exactly where you would fit the patella in, or the kneecap, that we'll see very quickly here. So the patella, a few things about it. First of all, notice in this aspect, this x-ray picture, there's the femur. Here's the patella, the kneecap, fitting into that patellar surface on the front. Down here would be the fibula and the tibia, the two actual leg bones that we're going to see in the next talk. Tib-fib is sometimes what you call them for short. Now the patella itself, if you could look at it from either the front or the back, kind of looks the same. It looks kind of like a sesame seed that you'd find on top of a hamburger bun. So notice the term here, sesamoid, shaped like oid, a sesame seed, right? So sometimes this is a seed-like bone called a sesamoid bone. Rather than calling it a short bone or a long bone or a flat bone, it's often referred to as a sesamoid bone. Sometimes it's the only sesamoid bone you hear about in lectures. So the kneecap is called the patella. There's not much to say about it except the point is often referred to as an apex. And then sometimes you talk about a medial or a lateral border, but that's not really too interesting to most people. So it's usually just called a patella. Interesting question here, and a question you hear from sometimes kids a lot when they see pictures of birds is, why the heck are these birds' knees bending backwards? I can see it again over here on this ostrich, I believe. Why are the knees bending backwards? Our knees bend forwards. Anybody think of the answer to this? I'll show it to you. The answer is, those aren't the knees. So look really closely here, and then I'll prove it on the skeleton. Notice here is a bird knee, way up there, and it is pointing forward the same direction as yours. In the ostrich picture, I can't even see the knee because it's obscured by too much meat and feathers. So let me show you the skeletons here, and I'll illustrate this. So again, the answer to why do birds' knees bend backwards? They don't. This thing right here that you're tempted to call the knee is not the knee. The knee is actually right here, and it is bending forward exactly as yours. So what the heck is that thing then that's bending backwards? Well, let's take a peek. Let's start with the pelvis. We can see it pretty clearly there. There's our obturator foramen, the little circle, and the pelvic bones. There's a femur, right? The big thigh bone that hangs off the pelvis. No problem. There's a patella. There's the kneecap. There's the fibula, even though it's very small, it's very reduced, and it's barely there at all. There is a fibula in a bird skeleton. Now here's the difference though. Instead of calling it a tibia, that's called a tibiotarsus, implying that it kind of merges with the ankle. So when we learn what the bone is here, if you study birds, this is the only place you'll find this. The humans don't have a tarsometatarsus bone, but that's what that is. And that's actually, again, forming the ankle of the bird. It's not forming the knee. The knee is formed exactly the way your knee is formed. They just have a strange tarsal bone that juts out and forms this ankle that sticks up above their foot. So next time you're asked, why do birds' knees bend backwards, you have the answer, they don't. All right, did you have fun with that one? Thanks for watching it. If you made it all the way through, check out some of my other videos if you want to learn more about some A and P. See you for the next one. Bye-bye.